Your job is not your family. I know that's controversial, but your job is not your family.
Welcome back. We are here for another week. We are clocking in today, actually.
Not clocking in.
Just came up with that off the top of my head.
Because you clock in, I don't clock in.
I don't. I'm salaried.
No.
Anyway, so, if you haven't got the reference, today we're talking about work.
Yeah.
Work.
You ain't gotta go to work.
We're talking about work today as it relates to being Latino, gay, as usual. We're excited. I'm excited today just because there are projects that I'm excited to talk about first and foremost, but also I don't know why. I'm just excited today.
It's a lot of our life.
Yeah, exactly.
Most of our
it pays our bills.
Most of our waking time. It pays for this podcast. For this.
Yeah. Yes. Yeah.
Yeah. Well, kind of.
Right.
Yeah.
Well, yeah. I mean, basically.
Well, mine. I'm kidding. I mean,
you're not wrong.
No. First of all, the financial contribution it takes all of us. It takes an army.
I'm like, I think I owe you money still.
No, not yet. That's why I get to slut you out on camera.
Hey, and if all this to say, please pay us more.
Yes. keep
watching, keep sharing, because all that leads to more fun and fun times and weeks with us. But how are you doing this week?
I'm doing good. It's been a great week. It's been a restful week. I've got a lot of good news in the personal front. As you know of last week's episode, my best friend doesn't hate me anymore. It's just been a great week.
Ooh.
It's some faggot.
I never hated you. It's always love.
Oh gosh. But anyway, on the topic of jobs, what was your first job?
Mine was a busboy at a hotel.
Oh, at a hotel.
Yeah, a Hyatt.
In high school or like
high school? Yes, I can't remember if I was 15 or 16. I was in sophomore or junior year.
You have to be 16 to work.
Okay, then it was 16.
Yeah.
I can't remember.
There are child labor laws. Mm-hmm. So here in San Antonio.
Okay. Yeah, here in San Antonio. I was a busboy for a restaurant at a hotel, which I enjoyed, but it was like on the weekend, or it was like part-time, obviously. And I forgot when I started. I want to say I started during like band season. So I was like there was a lot going on, but yeah, it was.
Why'd you get a job?
My parents wanted me to. And also I wanted to. Like, I wanted to pay for my own things. I wanted to be independent.
Yeah.
I definitely got that from my mom. Like being independent.
Should get it from my mama.
Right. Mm-hmm. Me. But that was it was probably the most labor intense job I've ever had. Actually, I lie. Technically, I had my first job, like where I actually got something, was with my dad, actually. Like, I would go help him as a contractor, and like during the summers I would go help him. And
what would you do? Hand him stuff?
Yeah, literally. I would if he did roofs, I would put the shingles on my shoulder and like go up the ladder. Yeah.
You're full trade.
I swore back then I was.
Did you pick up anything?
What do you mean?
You're a handyman, no? No, you're not.
No.
Yeah.
Oh, pick up as in like, yeah, no.
Wow.
I know how to use a hammer. I know how to use a drill.
Can you change the oil in your car if you need to?
No, absolutely not.
Wow.
I wouldn't even know where to start. I pay for people to.
I mean,
I barely even know how to change a tire. I mean, I think I feel confident to do that, but I feel like, YouTube would help me more.
It's the one thing I don't know how to do.
Change a tire?
My husband does it. We had a blowout one time, and he's the one that did it.
Full glam.
Yep. In full glam, yeah, full face. But anyway,
what about you,
that was your first job.
That was both of those.
My first job was making pizzas at a pizza restaurant.
Oh.
Mm-hmm.
You're Mr. Papa John.
Yeah. Damaho.
Oh. That one, I like that one.
You gotta stay ready, Jake. Come on.
See, you were. We all know you're the quick weenie. You're quick.
But yeah, that was my first job. I had a lot of jobs in high school, but my parents actually didn't want me to work. Mom and dad were always like, "You're in school, focus, focus,
yeah.
and do." But my mom moved out of town to go to work. She had a job and she moved to a place to go work for a year. And then my dad worked a lot too. So both my parents worked a lot. Mm-hmm. And so I was like, I'm not going to just sit here. And so I started working at this pizza place and got my little money. And yeah.
You started buying your own stuff?
I bought my own stuff. It was great. It was great. And so I did that. And then I also worked in the oil fields a lot with my dad.
Okay.
In the summers, my dad would always tell me, like, I want you to come out here and learn it so that you know what not to come back to, like, so that you're motivated to finish school.
That is wild because my dad would do the exact same thing.
Yeah.
Like he's like, I don't want you to do what I do.
Right.
Because like it's so, I mean, he was a contractor, so like all the labor intense, and he was like, nope, I want you to have.
Yeah. I was like in a hard hat. Everything.
Damn.
Mm-hmm.
Oh wow.
Yeah.
That is wild.
That's what I would do.
Did you ever learn anything from that, or pick up anything? Anything?
Not really.
Yeah.
I mean, there's not, because what I was doing, I was labeling like a bunch, like the plant. We were in like the oil plant, and no, the refining plants. I don't know why I said. You know, you leave West Texas for 10 minutes, you don't know how to speak. It was a gas plant actually, and so I was labeling pipes. So I would tell you where the direction of the pipes were going, so they would know. Because you know, there's a bunch of pipes, and so I was labeling. So I would create the labels and I would put them on there. I would mark them with a marker, and then I'd go back and label them with another engineer.
Oh,
that taught me how to do it. Yeah.
Okay.
Yeah, because they need to know the direction of where things are going in case there's a problem. They can cut things off.
Yeah.
And so they had people who just knew the plant so well that that's how long they'd worked there, that they knew the direction of everything. And
without being labeled?
Without being labeled. And the newer folks didn't, and so I had to go in there and label them all. It was a cool little job. I got that's cool. I got $17 an hour, which is pretty good. Yeah.
Damn, back in the 70s?
No, bye. No, this was 2011, because it was when I was in college.
Oh, okay. Yeah.
Because you had to be 18 to work in the at the plant.
And got it. Oh, interesting. And what do you do now?
What I do now? I'm a PR girly, but I work in communications. So I do communications at a communications agency, but I've done everything from PR to crisis communications, strategic communications, and with mostly government clients, but I've worked on a variety of private clients as well. Yeah, public clients as well.
That's why you're so good at social media.
Yeah, it's a part of the job, but
meanwhile, I'm just
my forte is in crisis communications. So things are going wrong. I can come and help you, but
which you're gonna help me soon.
My
work.
So I've done, which is why I think it's been so hard thinking about our community in Kerrville. Why it's been so hard to watch, because I do, not only do I do comms right now, but I do flood mitigation comms, which is exactly what's happening over there. And so it's just been really tough to watch and see how the crisis comms is an absolute failure there.
I was gonna say, what are your thoughts?
It's an absolute failure, like
from all aspects.
All aspects. The fact, so this happened just yesterday, and I don't know if you saw that the reported missing went from 150 to 4.
I saw that. Yes.
That doesn't happen because they found 146 people. That happens because they never had an accurate count from the beginning. And that, to me, everybody's like, and I it's great that there aren't people missing.
Correct.
I'm saying that right now. It's amazing that there aren't people missing, and I'm glad. But the fact that they can have the numbers jump like that means that no one was keeping an actual count of who was missing. It's a failure.
I thought about that too, because when I saw that yesterday, it was literally like, ew, the number went from 160 to 4. And I'm like,
they didn't find all of those people.
Happen?
They just didn't know the exact number.
What do you think from our perspective? Because I don't live in that world. So like I did take it as a success, because when I saw it, I was like, oh my God, they found all these people. Right. But like, they don't say that.
They don't. No, they just adjusted the numbers. And they said some of the people that we thought weren't missing weren't there. And so they're not really asking the real questions of what they should be asking. And that's the hard part about being in Texas, I think, because you have these elected officials who are part of the good old boy system. Right. And they're not used to being questioned. You can tell because a lot of them, when they were questioned after the fact, were just... It was an absolute failure. So it's been really exhausting to watch, honestly.
Damn. Mm-hmm. Yeah, that's really unfortunate, because then it's like, people seeing this. Yeah, it's like, there's such a distrust. I mean, even for me right now, I'm like, that sucks.
I think right now when it comes to local officials, it's especially in the mid to smaller towns, it's an overtrusting of those officials, thinking that wouldn't matter what they say. Because as soon as they came out, the first thing they were saying was, we're thankful for the first responders who are recovering these people, who are doing an amazing job. And I agree, they're doing a fantastic job.
Yeah, for sure.
But they're cleaning up a mess that you started in the first place with things and all. So we can talk about that for hours. But it's been really exhausting to watch.
I can imagine, especially living in that world.
Yeah. What do you do though?
So I work in healthcare.
Okay.
I work in the healthcare administration side. So I'm not patient forward. I don't see patients myself. I have team members that do see patients, but not for clinical care. I live outside of clinical care, more of the...
What does that mean for someone who's not in this space?
Yeah. So the clinical care, like when you go to the doctor, like those people that you see because like you're sick or for your well child visit or for like your just general physical annual physical update, like those are like the physicians, the medical assistants, or the nurses. I'm not in that world. I work with them day in and day out, but I do grants. So I help implement new programs. I help implement or open new clinics. I help with a lot of the administrative aspect and the operational aspect as it relates to grants and any funds that we do get for the organization I work with. I also have a Medicare team. So I live in the Medicare world also with helping patients get from that 64 to 65 range.
Yeah.
Get on Medicare. I don't know if I said Medicare or Medicaid earlier, but I work in Medicare.
You said Medicare.
Okay. I do that all the time at work anyways, but
yes.
Medicare. So we work with less senior population. And so like my team will see those patients and helping them, but again, not clinical. They're not diagnosing. They don't do anything of that nature. They just help with the educational part. And so I live in the educational population health to make sure that people outside of the clinic continue to be healthy.
Yeah. So when people ask me what you do, I just say healthcare administration. Is that wrong?
No, that's absolutely right. That is the broad range, but like there's so many, like healthcare administration includes accounting, includes HR.
Most people that ask those questions don't know that. They're just like, oh, okay.
Yeah.
What would you say
I'm behind the scenes.
when people ask you what I do? What do you say? I'm a bad bitch.
Basically. So I remember early on, I'd be like, oh yeah, he does social media.
Girl.
Remember?
I haven't done social media in years.
Until this.
Yes.
But no, now it's more of the PR. I'm like, oh, like he helps with PR.
Yeah.
Like recently.
Stratcoms is the best way to say it. Strategic
communications. Okay. I don't know.
Yeah.
Yeah. That makes sense. Cause also I noticed, not noticed. I knew you did the crisis comms. So
yeah,
like that's actually why like you're going to help us at my work with understanding how to kind of go in and day in and day out with that. Yeah. Especially cause I also work in the marketing team. So I have a marketing aspect to my job as well. So
wow, you do a lot of jobs.
I'm a bad bitch too, as it relates to healthcare.
Oh, when it comes to work though, have you ever been closeted at work?
Not forcefully.
Not forcefully.
That came out really bad. But not me stuttering.
No, you're good.
Not intentionally, more so. Like it's not that I was like trying to be closeted. Oh. I think once I came out, and I came out later in life, but I was already in the workforce.
Yeah.
So it's not that I tried to be closeted or like I intentionally don't say I'm gay or don't say, yeah. But it's just more of like, I am who I am at this point. So now I can say I don't. Maybe early on I was like, yeah, I'm going to like hide that. But also like, I do code switch sometimes, but I wasn't.
We're not there yet.
But I sometimes like toned myself down.
Yeah.
Which is like the internalized homophobia.
Yeah.
But now I'm more like, I walk in the door. I have my purse.
Yeah.
I have my bag that I use for work is like a Michael Kors like merce. It's a big one.
Yeah.
Like I carry everything. So I'm like walking in.
It looks like the on Halloween Town, you know, the grandma would walk in with the purse. That's what your purse looks like.
And it's like walking behind.
Yeah. It's like walking behind it.
What about you though?
Yeah. So I was actually closeted for my very first job. So when we say our first job, we mean our first corporate jobs, like out of college, right?
Oh yeah. Okay. I have a completely different answer, actually. I was thinking my whole career, even like before I graduated.
So I think the difference between like being closeted means that you already knew who you were and were actively like not saying anything about it. That's the way that I define that. So for me, when it comes to my first job out of college, I worked in Capitol Hill, I worked in Congress. And I was all the way in the closet for that one.
Vastly different.
But because I hadn't even been with a guy, I kissed my first man the week that I got the job on Capitol Hill.
I don't think I knew that timeline.
Yeah, I got the job like it's like November 2013.
Huh.
And yeah. That was the first time I was like
I did not know that.
Yeah.
I knew like the first kiss when it happened, but I didn't realize like the overlap.
Yeah, I started on Monday and that happened like that weekend.
Oh,
now you know my whole tea.
Damn.
I know, 12 years ago, but here we are. But yeah, so most people at that job didn't know that I was out.
Got it.
Or didn't know that I was gay because I wasn't out. I wasn't out to any of the folks at the job. So I had that job. That's been my longest job ever. I had that job for 4 years.
That's
which
wild.
I know.
That is wild.
I know. People are like, what do you mean that's the longest job you've had? Yes, because I was building my career, making my life happen.
Right.
But yeah, so I was closeted for that job. And then when I got my second job, when I worked for the Brits, I worked for the British consulate in Houston. I started and said, I'm going to start, and this is me. This is who I am, and I'm never going back from that. And so I did that moving forward after that. And it's hard because I think I talked about this in previous episodes, but it wasn't until 2020 that the Supreme Court made the decision that you couldn't fire someone based on sexual identity, gender identity and sexual orientation. Yeah. So before that, when we first started, they could just say, I'm firing you because you're gay. Yeah. Now, that's not to say that people still aren't being fired for being gay. They're finding a different way to do it than actually saying, I don't want this person to work there because they're gay. Right.
Oh yeah. But yeah, going back now that I understand like the context, I have not been closeted.
Yeah.
Like I always came in very intentionally, actually. Like, this is who I am. I remember like being in interviews, like I have a husband, because at that point, my current job, I remember going in like, I have a husband, like my husband and I live here and all this stuff. So like I was very like, this is me. Take it or leave it.
Yeah. See, I don't bring that up, and it has nothing to do with hiding who I am, but I am very careful about what information I give at work in general. And we'll get into that in a second, but that's a big part of and I think that a good point on that is about being authentic, because it's like, how can you show up to work and be authentic? To me, that doesn't mean completely revealing yourself. That means showing up and not hiding who you are, but there are some parts of me that my job will never see, and I don't want them to ever see.
Oh. Is it more of like a code switching thing, or is it more just you want to make sure you keep that private?
I think my job doesn't deserve everything that I am as a person, and I'm not defined by my job and what I do for work. And I think the way that I can make that differentiation is by not revealing everything about myself to that. As an example, I think like I only have my current job, which I've been there for more than 3 years. I only have one of my colleagues on social media.
You told me this like a couple weeks ago.
One colleague, and and nobody knows that I'm doing the show.
Interesting. Oh wow!
Because this is a different part of my life. It doesn't need to be. I don't think I need to share that with them. And I love that differentiation. That I'm very intentional about that, because I've had jobs before where it wasn't like that, and I made a decision moving forward that I was gonna have. I'm here to work and
get my job done.
Get my job done, and that's it.
Yeah. I'm curious. Do you think there is an aspect of, because you work fully remote?
Yes.
I'm hybrid. So my job is also based in San Antonio. So like, do you think there's anything, is there a difference in that?
It makes it easier to do that. And that's specifically why I did it, because the distance was helpful in that too. Yeah. Like but when I'm in DC where my coworkers live, we're always hanging out. It's like I have an actual sort of like coworker, like a
relationship with
my coworkers, but just in a very different way than I've had elsewhere.
Interesting. Do you think you would ever get to that point? Because you've been there for 3 years.
I don't want to.
No. Okay. You were creating that. You created that boundary to make sure.
Correct.
Got it. Okay.
I created this myself and specifically wanted it to be like this, where that's my job, and I'll go to there. I'm there from like my 9 to 5, and I'll come home and do my other things. And I had to make that distinction, especially because I'm working from home, that if I don't have that clean break, it feels like it's all together, and I don't feel safe in my own. I mean, I don't feel relaxed in my own home.
Like you don't have that break of like, okay, it's 5 o'clock, I'm done.
I do. I'm intentional about that.
For that you reason. Have that. Got it. Yeah.
Yeah.
Because I hate bringing work home.
But this is also the happiest I've ever been in a job. This is the most fun I've ever had in a job. And this is where I feel the most myself in my job. So that's what I mean when I say it's about authenticity. And that doesn't necessarily equal giving up a part of yourself to your job. But yeah.
Oh, I love that.
Yeah.
I'm very open with my job. Like I have.
But that's what I'm saying though. It's not that I'm not open. It's not that I'm not open. If they know what my husband does, they know what I do. I'm just not offering information up, and they don't ask me questions like that to get anything up.
Got it.
It's not that I'm not open with them, because me, I'm an open book with everybody.
Right. But that's why I'm like interested.
But it's not in that way. I like having that divide. Having that break.
So what if someone comes to you and they're like, "Hey, I was on TikTok and I saw you.
Great. Do you like the show? Did you subscribe? Did you like it?"
Yeah,
absolutely.
Okay.
But in my previous world, I would have been like, "This is what I'm doing. I want everybody to know that this is like no."
Oh wow. Okay.
If they see it on their own, then my algorithm's working. But if not, then that's very.
Then
different.
I was right. You did social media all along.
Right. Right. No, I didn't say I didn't know how to do it. I said I just don't do it mainly now. But on that though, speaking of code switching, can you explain what code switching is?
Yeah. So code switching is like when you go into a place and you actively act a different way, just to like, whether it's like hiding yourself or being, I don't want to, it's gonna sound harsh, but like being a little less authentic in the sense.
See, we have completely different views of this.
Really?
Yes.
What is yours?
Because
what is
it's not less authentic. For me, it's a safety thing and it's a protecting of who I am.
Yeah.
Because I can be authentic and still code switch. Because my job doesn't have a complete access to me. You don't.
Got it. Yeah. Yeah, I think more of it like.
You know what I think it is, honestly, if I'm going to diagnose you here?
I'm a therapist.
I think it's because of how great of a relationship you have with some of your coworkers. And you have really genuine people at your job that are like amazing people.
Yeah.
And for me, I haven't let them get there yet.
Yeah.
And I think the distance helps that.
Okay. I think that's essentially why I was asking about the remote. Because I was like, damn, am I doing something wrong?
No, but you like it like that.
Oh no, I do. Like I love, like I literally call my coworker my work wife. Like, I don't know if you know that.
No.
Yeah.
We'll get to Don't Piss Me Off in a bit.
I call her my work wife, because we're so close. Like we hang out after. Granted, she's my peer. She's
who watches the show, and I love her. So thank you for watching. Tune in all the time.
Yes. But like there's a difference as far as like she's my peer, like she's my counterpart.
Right.
And then I have like the people that are under me. But code switching for me is a little bit more like I'll be less gay, essentially.
Yeah.
Like that is me. And I also.
But what's the reason?
I think more of this, like, I am coming to work. Like, it's more of like for me, it's a little bit more, now, it's a little bit more of like, I am coming to do this and this only. Like, I want to leave everything else aside. I don't want to have, whether it's like microaggressions thrown at me because of a specific situation.
Yeah.
So maybe it is a little bit of a safety thing too.
Mine's a safety thing.
But it's more, like I just want to talk about this and this only.
Right, I'm here to do my job.
Yeah.
Yeah.
That's when I'll code switch. But there are times like, I mean, I can be in a meeting. I can be in a meeting.
I'm like, damn, what do they do to your job?
And I was like, wait, meeting. I can be in a meeting with the same group of people. And if one is about, let's say like our gala. And if another thing is about like actually opening a clinic, I will be different in both of those. Cause the gala is a little bit more fun to me or like, it's a little bit more like outgoing or like, talking about specific, what to wear.
But I think that's okay. I think that's you adjusting yourself, compartmentalizing and being the person that you need to be for every, engagement.
But for me, that is code switching a little bit to me.
But it is, but I'm saying, do you think that makes you less authentic?
No, not really. It's just more of like I am here to do this. I think
that makes you good at your damn job.
And that only. Yeah.
I
never thought about that. Yeah.
I think it makes you good at your job because you're like, you have to meet your audience where they are. And whenever you're talking about a certain topic, you have to talk about certain things.
Yeah.
And so
it's like really quickly, like it's so funny because when I go to the barber, the way I code switched on that.
My barber just asked me this. I just got my haircut 2 days ago and my barber said, those videos, I laughed so much. Yes. But every barber that I've ever had, because I see them so often. I see my barbers more than I see my mother.
Well, yeah.
And so for that, I have to be 100% comfortable. So every barber I've had, and since I've been actually cared about my hair in the last sort of 10 years, have all been super accepting of me.
Yeah. Well, my barber is too. Like, and he'll ask me like, "How's your husband doing?"
Yeah.
Excuse me. But
you're with other barbers, right?
Excuse me. Yes. There's like it's like a room, but like,
sorry, y'all, we're coughing. It's allergies are bad today. We're like, we're coughing.
I think I just like choked on my spit a little bit. But I got a little excited. But yeah, it's so funny to me, like the way I'll code switch. I'm like, "Hey, what's up, bro?"
Oh, no. I never do that. That's being inauthentic.
That's
because you don't be like that, girl.
Because that is where code switching comes into play in my head.
Got it.
But like, I don't differentiate like code switching at the barber versus code switching at work. So in my head, it's all like one thing. Like, there's differences in the way I code switch for sure. Like with work, like you're right. I think it's more of like I know what I'm doing or like I know the audience, but like I will.
You want to hear something weird? How I think about it? I think about it like as a transaction. They're paying me, so I have to adjust to them. I'm paying my barber, so I'm not adjusting shit.
Oh, yeah. I never thought about that. I never take that into account.
It's a very capitalist way of thinking about it from my But here we are. Speaking of capitalism, we'll go into the next section about, our jobs more as we continue.
Yeah.
Hey, everyone. Just a quick reminder. If you're watching, don't forget to like the video. And if you're listening, leaving us a review goes a long way. But honestly, the biggest way you've helped us grow so far is by sharing the show. So if you're loving it, send it to someone that you think would love it too. Now back to the show. All right, we're back to the JK But Gay show. I want to start by talking about gay jobs because I feel like a lot of gays have similar jobs. So what are some gay jobs to you?
Flight attendant.
Nurses.
Barista.
Realtors.
Marketing people.
Military.
Hairstylists.
Teachers.
Podcast hosts. Us. Yeah. We're the gayest of the gay.
Yeah. So thinking about work though, are you the gay one at work? Are you the token gay?
I think so, actually, now that I think about it.
Really?
Yeah.
Are you the only one?
No, there are others. There are others behind me.
Right.
No, I'm just kidding. No, there are definitely others, but I think I would say, I feel like I'm maybe not the token gay. And this is not to sound
I was making a joke, but
oh, my bad.
No. But I mean, yeah.
I think also, and this is not to like brag, but like I feel that I'm within senior leaders, like our senior leadership.
Right.
I'm the one that's usually at the table. Like
same.
Like I'm the gay one.
Same.
At the table.
Same.
Everyone else, like they're more like frontline.
What's your goal being when it comes to being gay? What's your goal in that space?
I want to be that. I want to be a voice for others that don't have the voice.
For me, and I think about it a lot, is to not be the only one. I want to pull up a chair beside me. Say, come on.
Explain.
If I'm the only gay there, then I'm not doing my job. I need to bring somebody else up with me.
Oh, you want to help
putting the hand back and bringing
come with it. Mm-hmm. Oh, got it. Okay.
A lot of times, I feel like I don't have very much say in that in some aspects.
Yeah.
But for the most part, I'm with all of my colleagues that are gay. I try to nurture their careers if they're younger.
I love that.
Yeah.
I'm going to carry that more.
Yeah.
Because I don't feel like I do that.
There's no point in being first if there's not anybody else coming behind you. I had a mentor tell me that one time, and I take it forever with me.
I absolutely love that.
Right. Because I know we're not gatekeeping because that's not our personalities.
Absolutely not. Yeah.
But there's the opposite of gatekeeping, which is busting the gate down.
Yeah.
And
bust the wide open.
Yeah. and
every
do
time
it that
we
way.
say bust, I'm like something else.
I know. I'm like, damn. Once we start JK but gay uncut, then that's when we'll bring it in. But uncut is an uncensored nasty ass. So you are the gay one at work.
I am. Yeah. But I love that. Like, because now I feel like I'm a little selfish, but I don't, because I want to have someone else at the table like that gives that voice. Because sometimes I also feel like they're doing it or not. Well, yeah. No, sometimes I feel like I'm pointed out. Like if something comes up and it's about like, you know, how are we going to help with the HIV rates in the city? Then they look at me and I'm like,
right.
Why are you looking at me? You know, like I know why.
You have an entire list of practitioners who should know this stuff.
Exactly.
And you're looking at me.
Don't.
Oh, damn. I didn't see all that. Because they're not forced to. Right?
Exactly.
It's
no,
like
it's
this is our population.
Absolutely the system.
And this isn't unique to your job. This is the industry in general.
No, for sure.
Who needs to be better about that?
Oh yeah. And this is a personal thing, but like as it relates to where I work in healthcare, obviously.
Yeah.
But like I remember one time I went to the doctor and the doctor was like, "I'm gonna give you an HIV test because you're gay."
Oh hell no.
And I was like, "I'm never coming back to you."
Right.
Ever.
Right. I have a story for that too, but I think we're going to go into healthcare. So I'll hold
maybe
on
that was
to
a healthcare story.
But no. That's a good story for this because it's your industry. It's not my industry.
Yeah,
That's why I thought that was a good point to add. But yeah, I think for me, I think in previous jobs, I've been considered the gay one at work, and I've sort of felt that environment. It didn't really offend me because I think a lot of times it was I was able to influence policies and things like that. I think one of the things that I talk about a lot is that like I am the head of the LGBT ERG at my company, or at my office. So for those of you who don't know, I think a lot of people don't really know because they don't have access to ERGs.
Right.
But
even more now.
ERGs are employee resource groups that are, I think our job calls it affinity groups, and it's where you come together as a community and just sort of build community with each other, and then sometimes you influence policies as well. But anyway, I think that, you know, when it comes to the workplace though, have you ever had any kind of workplace microaggressions or even, you talked about this in your live, I think before we go into microaggressions, have you ever been like discriminated at work?
Yes.
Oh, tell us.
And it wasn't another employee.
Yeah.
But I had one time when I was working at the Hyatt, I was a concierge at this point, and someone like, I was wearing my suit, I was wearing, probably a bright color, but I don't know what like invoked this person to do it, but like they just literally walked up to me and called me the F word.
Wow.
And then like went in the elevator.
We don't say this word on the podcast no more, or what?
I got really nervous actually.
I know, he called you a faggot. But no,
no, he did, yeah. And it was like some random person. It was a guest at the hotel, and they randomly just like came up to me, pointed at me, and said that, laughing, and then like went up to the room, and I was just so caught off guard. I was like probably 19 or 20.
Oh no!
Yeah,
that's so scary.
And I was just like, I don't know what.
Were you scared? I would have been scared at that age. I would have been scared.
No, I remember I started crying.
Oh,
I wasn't scared. I don't.
What were the tears for? Because you don't cry.
I know. I think I was just kind of like hurt.
Oh,
like
that anger I talk about.
Fear.
It's like
it was that.
No. Like when you're talking about this.
Oh yeah.
I feel the anger. I wish that would happen in front of me.
Yeah. No. Well, I went to go talk to my coworker, and I was like, "So this just happened," and I was crying at this point, and they're like, "What is wrong?" And I'm like,
yeah,
what's happening? And then the guy like literally went. It became a thing. Like
absolutely.
Yeah. And I think at that point I was like, oh my God, like I loved it. I knew I was in a safe space. The security guard actually figured out who it was and kicked him out
of the hotel.
Yeah.
Was he staying there? A guest?
Yeah. No, he was
as
guest.
It should be.
Yeah.
That's how you show up for your employees.
Right.
That's how you show up for them.
You be an organization.
And because I've been in plenty of organizations where they just kind of let things go.
Yeah.
Or like eliminate us from the situation.
Yeah.
And that's not
They're like,
true
it's
activism.
okay. You gotta let them like. I do remember. I'm almost positive he was drunk, but like that still does not eliminate anything.
Yeah,
like that. If anything, just like it exacerbated everything.
Mm-mm.
But yeah, like I remember. I wasn't scared, but I was just like sad because nothing like that had ever happened to me, and like the discrimination or anything. And I was also like in Austin, and which anybody outside of Texas. Austin is very progressive and like very blue and all of that. So I was kind of like thrown off. I was very thrown off, obviously. Like I started breaking down and I was like, what the hell is happening?
That's crazy.
Yeah. Other than that, what about you though? I'm trying to think about other microaggressions that have happened to me, but what about you?
I think as far as actual hate, no, but microaggressions, it sort of happens all the time.
Lot.
Actually, in this current job that I have now, that I've had for 3 years, not very much at all, because I am surrounded by people and managers who just don't play that shit.
Yeah.
At all. And so, but I've been in different ways. It's not necessarily, I think one of the things that happens a lot when you're one of the only gays in the workplace is that when a new employee starts and they also happen to be gay, something that has happened to me a lot where they'll say, you know what, we just got this new employee and I think you would love him. And I'm like, as a homosexual about to walk in, then they walk in with their bag, like you with the purse. And I'm like, it's me. But that's why they're saying it. And I don't think they realize it's a microaggression, but sometimes that doesn't mean that all the time that doesn't mean it's okay.
Right.
But yeah, they'll say that like, oh, I think we just got this new employee and I think you'll love him. Joke's on you. We all hate each other.
Watch the show.
Right.
Episode 1.
We talk about how we all hate each other. But yeah, I get that a lot at work. Or I know one time actually, I'm not sure I think this has more to do with where I was in life, but I had a coworker say that I should be the one that was on call because I don't have the responsibilities of having kids. Yeah. And I remember there was another coworker who watches the show all the way from Panama. Yes. She immediately messaged our boss and was like,
during the meeting.
Yes.
Okay.
And was like, that you need to tell him to cut that shit off. We both left like a month later, but it was ridiculous. Yeah. I was like, no one's going to say anything. No one said anything. And I laughed in all their faces. Like the colleague that made the phone call, she was calling in virtually, but I laughed in everybody's face. Like while I was already about to leave. Okay. So I laughed in all their faces of like, are y'all really not going to say anything?
Yeah. Like, wow.
Right.
I think for me, I'm trying to think of like a recent microaggression, which I think my company's been very well. And I love the people I work with like a lot, but sometimes, as it relates to anything related to pride or gay or anything like they always go to me.
Yeah.
Which it's hard to say because sometimes I'm like, yeah, I want to do that.
Yeah. Some of
it's the approach sometimes.
Yeah. It depends because what we do want to teach people is that if you want to do pride or even Hispanic heritage, any kind of things like that, go to the people who experience it so that you can get their thoughts from them, but don't give them the burden of being the only ones that pursue these things.
Right.
Everybody needs to be there.
Situation.
Yeah. That's what I like about the ERG group that I lead, is that our leadership shows up to all of our stuff, all of our events.
Oh, I love that.
It's not just y'all go over there and do your thing. No, they're
Right.
showing up to all the events. They're learning. We're doing all of these things so that we can grow together.
And ERGs are so important, especially for like the allyship.
Yeah.
Whether it's for the, whether it's the pride group or whether it's the women's group or the Hispanic, whatever disenfranchised group it is for, like being an ally for them sometimes speaks more volume than like the people within.
Should allies be in ERGs for Pride?
I think so. Why? Do you think so?
So we just have the discussion a lot in the workplace of if they should or they shouldn't.
Yeah.
I think it's okay for, I think it depends. Because I'm a part of the Latino ERG as well. Mm-hmm. I don't think allies should be in the Latino ERG, but I think they should be in Pride.
Oh, so it's based on the population.
Correct.
Oh. Mm-hmm. I'm not there to educate them, but if they want to learn on their own,
right,
that is okay for me.
Right.
Yeah. Like I'm not going to spend a day in and day out telling you what you should or shouldn't do.
Right.
You should learn that.
Yeah.
And you should want to learn that.
Do y'all have ERGs?
We don't.
No.
I actually pitched it to our CEO, but we have so much going on and like it's kind of hard to start.
It's tricky now because
especially
now on that part for Ally though, the current administration is making changes to the EEOC, which is the Equal Employment Employment Opportunity Commission.
Mm-hmm. I don't know what it is.
Anyway,
I just call it EEOC.
Anyway, I used to do casework for them. But anyway, EEOC, they regulate the way that people can be treated at work on a federal level.
Yep.
And one of the rules that they adjusted was that you couldn't have ERGs if they were exclusive to a certain group.
Right.
So the allyship now, it has to apply to everybody.
Yeah. Like
so,
every group.
Right. You can't have something just for Latinos. It has to be Latinos, but open to everybody.
Yeah.
Which is ridiculous. Yeah.
Interesting. Like sometimes you just want a safe space and just like.
Yeah. So that's what it is the safe space. Needing a safe space.
Which I get.
Because there's certain things. That's what I use my ERGs for at work is mostly safe space, because there's certain policies that don't apply to us, or certain things. I think as an example, in recent years, we had a blood drive at our job. And I told them how that wasn't inclusive, because for those of you that don't know, we'll bring it up in our healthcare thing, but there is a really homophobic policy that says that gay men specifically, it's unique to gay men, right? Not women.
Well, it's men who have sex with men.
Right. Cannot donate blood because of the increased risk of HIV.
Correct.
But all blood that is donated is tested for HIV.
Right.
So it's a AIDS epidemic policy or error policy that has stuck since then.
Yeah.
And so
I have a lot of thoughts on that.
I have lots of thoughts on that too. Yeah. So we'll get to we'll talk about that in the healthcare one.
Yeah, for sure.
But yeah, so we can't donate blood. You can donate blood. They changed the rule. They thought they were doing something. They changed the rule and said that you can donate blood as long as you've been abstinent for the last year.
3 months.
Either way.
Well, it used to be a year. It used to be a year. And with the changes, I'm almost positive it went to 3 months.
It used to be 0. And then it moved to a year, because I knew someone who did that for a year, like as part of reporting. It used to be 0. When I lived in DC, it was 0.
Wow.
And then Obama moved it to a year.
Even then, I'm like, get rid of that shit.
A year is wild.
Yeah.
But if you don't want my blood, fine. Joke's on you.
Right.
It was really tough when I noticed it the most was in Orlando when Pulse happened.
Oh yeah.
Everybody who wanted to donate couldn't. And it's wild. We'll get into that. We'll get into that. But anyway, on that point though, is that I brought it up to my job of like, you need to have an alternative volunteering opportunity.
Opportunity. Yeah.
Yeah.
I love that. Yeah. You're making those changes at work.
Yeah. We'll get into that, but it's hard sometimes to be the gay one at work. And the good thing is that my job never sees me that way. I don't think they see me that way. I'm not in an industry where it's that connected as yours is. I think yours is much more connected to serving those populations.
Right.
But I think for me, it is, I like to put myself out there in those ways if I can be helpful, but don't tokenize me.
Yeah. And that for me, there's a very fine, like it's so, I don't even want to say fine line. It's so gray for me.
Oh, really?
Yeah. Cause like for example, and I'll get to this, I'll explain a little bit more of like the successes, but like I was approached because I was gay in helping with how can we limit or eliminate HIV in our community. There was no doubt. I was like, I want to be on this project.
Is that medical language?
Yes. What part?
I didn't know they use that. Eliminate.
Yeah. Yeah. It's just,
So then for me, it would, I'm sorry, we're gonna get really deep there. You can cut this out if you want.
No, yeah.
But it's like if the eliminate is the word, and this is the PR person to me and vocabulary and what words mean.
I know what you.
If it's eliminate the word, then it's R&D. It's a whole list of things, not just patient care. Because I thought that's what y'all focused on. But if
we do the focus, or we do focus. It's eliminate the. There's a phrase, and I'm blanking on it. Sorry, actually, it's end the HIV epidemic.
Right.
Sorry. Yes.
Sorry. I just like
no. Because it is. Yeah. Because eliminate can be taken vastly wrong as it relates to HIV.
Well, no, it just means eliminate. And eliminate is not fully what you are in, right? You are in the lowering the number of cases rather than the R&D side of it.
Correct. And we want to stop the spread essentially.
Got it.
Like that and so it's eliminating the virus itself kind of.
We're going to have so much fun in that episode.
Yeah. Yes. Yeah. Oh yeah. I'm excited. But like it's to me, there's a huge gray area just because like I want to be approached in that, but like I also don't want to be approached because I am gay.
It's different. I think it's the way that, like you said before, it's the way that you're approached. And I think
it's what they say.
We say it's gray area, but I think we know the difference. I think the fine line, there is a fine line, but we know it.
Yeah.
And when we hear it, we're like, here we go. And what you don't want to do is give the opportunity to someone else who actually doesn't know these things. Right. And so I've done a bunch of DEI work at work. And I think the best way that you can do is make sure that you have folks from all over, right?
And diversity
and you don't just have the one person, because when you have that one person, that's when it becomes tokenism, and that's when they're the sort of like diversity hire, which we'll get into.
Yeah. And I was definitely not the only one, but I was like asked to be part of it, and like I wanted, and then I was like I guess I was kind of like the lead essentially, but like creating that team of the diversity at the table, because I don't know the clinical side, so I had to have a clinical champion and all that stuff, but yeah.
All right. Well, thinking about, being the DEI hire or being the diversity hire, which I think we've all felt like, and when it comes to work, I wanted to talk a little bit about when DEI efforts seem very performative. And I wanted to talk about this specifically because I feel like we've been seeing it a lot lately. They always kind of felt, a lot of corporate companies promoted pride a lot. And then this year, when things turned on the head, they ran for the hills. And so for me, I'm like, y'all were never about it in the first place.
Right.
Y'all were never about it in the first place. And if it was really ingrained into your culture like you needed it to be, it would have kept it. It would have felt like a disrespect to your brand and to everything that you're doing. So it's really been irking me because I've been seeing, and I'm keeping track too. I'm like,
oh yeah, I follow one. I forgot who it is, but they'll show their names, and I'm like, say their names.
Yep.
Yeah, for sure.
Are there any things that work that feel performative for you? Or not necessarily, and I feel hard because for me, all of my stories are like my previous job, and yours are like a mix. But we also love what we do. Oh yeah, I don't want it to make it seem like we're not. We love our jobs. Our jobs support this podcast.
Absolutely.
But are there any things specifically that you felt are like performative, or if you do have anything to say about the corporate stuff?
My job, I really don't think anything as it relates to what we're discussing being performative. You know why? I feel like there's like not enough.
Yeah.
I think that's why I don't think there's anything that's like overly performative, because I don't think we do enough.
I don't think things are overly performative because you wouldn't allow it. And I think you're at the table to make those decisions.
Right. But I also feel like sometimes they're like, no, we don't need to do this.
Right.
And I'm like,
let's limit it. But I do want you to talk about what you've had a big role in, because I think that's fantastic. So if you want to tell, we talk about it on, I was like, we've talked about this before, but we talked about it on other people's show, but not our own.
Yeah. So this is absolutely like my biggest
accomplishment. Have you seen those videos?
My proudest moment. Yeah.
Which one? Those videos where they're drunk and he's like, my biggest accomplishment, and they're all trying to say accomplishment.
No,
you ever seen that?
I haven't.
It's like in the Valley where they put the mic in front of them and they're drunk. He's like, oh, my biggest accomplishment is...
Oh, yes. I think I have. Yeah. I'm like, first of all, y'all in the Valley.
That was you just now.
Right. I was like, I didn't even say anything because I know what I was going to say.
I know.
No, but definitely my most proud the thing that I'm most proud of, my biggest accomplishment in my career. Girl, I swear I'm from the 210.
Yeah, but you're from the far west side, so it's kind of the same thing.
But
you went to Warren High School. We get it.
Right. No, but so as I mentioned earlier, I have been asked like, hey, we want to help tackle, the HIV rates in our community and everything.
Yeah.
And I was like, I count me in, like,
Yeah.
abso-fucking-lutely. And then of course I was able to like lead that project and really bring in clinical champions and like other people that I needed help with. Like I could not do it on my own, but I was able to get a grant, specifically to help end the HIV epidemic. And from that came about one of our clinics. It's called Apollo Wellness. And it was probably like the best and most fun project I've worked on because I literally worked on like the inception of like the business plan itself. I went to go look at spaces. Like I went with a realtor. Like everything, like, and from beginning to end, of course, I brought in everybody, like the senior leadership and everything. But yeah, like opening it took about probably like 2 years from like when I was first asked to actually like opening the doors of this clinic.
Yeah.
It took 2 years. So it was like a long 2-year period. It was long because the first year we didn't get the grant and then the grant came about again and I went for it and we got it. And they were like, okay, we're going to make it happen. So it was like like an intense 1 year.
Yeah.
But like from the beginning conversation to the next, it was.
Yeah. So you created a clinic focused specifically
on HIV prevention, treatment, management.
Right. But also as a wellness care for, primary care for a lot of people.
Yeah.
Who want to be in a place that's really comfortable for them.
Exactly. Very inclusive. We were very intentional. Me and my work wife, we were very intentional in the space, in the way it looks. We wanted it to look very high end, very classy, but also really, really creating that inclusive environment where people feel safe to talk about something that, technically is still taboo in today's world, as it relates to like sexual wellness. In general. And so we were very intentional with like how the clinic is going to run. It runs vastly different than all of our other clinics, but I'm so proud of that clinic.
You should be.
Yeah. And sometimes I do forget. I forget to celebrate. Like,
no,
this is huge. This is a huge win,
deal.
But I even forget to celebrate the little wins.
There's a lot of people that don't feel safe going to a normal doctor.
Right.
Just as a plug, I'm patient zero. I've been at Apollo Wellness since it opened. I think really early on. And for me, it was really important to be in a place where they understood the things that gay men, just encounter in healthcare. Right. And someone who was open and inclusive in those things. I am fortunate enough to be HIV negative, but that's in part because of the care that I get because of Apollo Wellness. And I think the things that you all are doing and that you've created here is just, I'm so proud of you because it's so fantastic.
Yeah. And it's kind of like not simmered, went throughout the entire organization just because, like, as I mentioned earlier, like clinicians are not trained in medical school, like how to have those conversations. As I mentioned earlier, I was like discriminated against because I was gay and HIV. Like I'm not living with HIV, but like that doesn't, like, there's no correlation between gay and HIV. There's a huge stereotype, which still lives lives to this day. And
the rates are higher in gay men. I think we'll get into that, but there's a
difference between stereotypes and statistics,
right? And providing for a community that needs it is what you're doing. That's the difference. Exactly. That you're providing it for them. So I'm really proud of you because I think that's such a big accomplishment.
Yes,
accomplishment.
Yeah. But yeah, what about for you? Like, what have been?
When it comes to the alphabet mafia, specifically, I think for me, it was about policies. I have done some work in my current job and in previous jobs about increasing access and policies at work. I think an example of that,
I love that.
Is that our bereavement policy at work, it's usually tiered. Right. So it's like you get, actually ours is really good. It's like you get like 20 days for an immediate family member. So like a spouse, a child, that's a lot, right?
That is, like that's 4 weeks.
Yeah.
Holy crap.
Yeah. For a parent,
amazing.
For a parent, a child, a sibling, or an in-law of those, right? So like your mother-in-law, your a stepkid, all of that is included in one.
Okay.
But then it tiers down. So it's 5 days if it's for everybody else. So it's like for your cousins,
That's still really good.
For everybody else. It is, but that policy in and of itself is not inclusive. of Latino populations, and it's not inclusive of the LGBTQ population.
Yeah.
Why do I say that? I say that because sometimes, especially, let's start with the Latino side. On the Latino side, if my cousin passes away, that's like my sibling.
Right.
I'm going to need more than 5 days to be able to deal
Right.
with that. And so the way that the policies are built are usually a more white-centered focus, right? Of like, you know, because white people have cousins and they're like, I haven't seen them for like 7 years, you know?
Right.
But that's not the case for us, for Latinos. And sometimes our grandparents raised us as their kids, right? And so you have those things. And so I fought for and accomplished a disclaimer that says your manager can approve, and they usually do. I don't think we've encountered this. A manager can approve it if it's similar, if they played a role that's different.
Okay.
And that also,
I love that.
On the LGBTQ side, I pushed them to change the policy to be more of a chosen family. And because
that's exactly where when
it comes to the LGBTQ community, sometimes we have a chosen family that's stronger and more supportive than our actual family, our like blood relatives.
Yep.
And so that small change, I think, makes a big difference.
That is a huge difference.
It makes a huge difference because that's what we're seeing in the workplace. So that's something I don't think I've ever talked about it, but it's something that I was really proud of because we have amazing, and I knew that we had amazing policies. Like I said, 20 days is a lot.
Yeah.
That's an amazing policy. But there was just no one in the room to say those things. And so once you say, they're like, all right, let's go.
Yeah.
We'll make it happen.
Yeah.
And they did.
And that's why it's important to have like diversity at the table.
Right. It's important.
So proud of you.
Thank you. It's important to have those people in the room so that they're able to help you. And my job does amazing. We have an entire wellness program specifically for the LGBTQ community. Like that includes surrogacy. It's like the same amount of paternity leave as maternity leave. It's amazing. We have an amazing policy.
Wow.
Yeah.
Oh my gosh, I get like 3 days of bereavement, no matter what, like
That's
whoever it is.
Wild.
That's all. And it's only within the 365. Like you have 3 days. Once you use them, you're gone.
Oh no, ours is per death.
No, ours is per year.
So if you lost, like let's say you lost your mom and your dad the same year, it would just be 3 days?
Correct. The other times I had to take PTO.
No, I know I'm blessed.
Yeah.
I know I'm blessed. And I know what you're describing is much more common in the workplace.
Right. And I will say, I
Your job would be like, we'll figure it out. Like take your PTO.
Oh, for sure.
Or like, yeah.
That for sure, that part. And they will do that for like any employee. Yeah. And I will say, I wholeheartly believe like they are only able to, we're a nonprofit.
Yeah.
So I think it's more of a financial thing.
Yeah.
And way less, probably not even like, like whether it's culture or identity, like it's less of that, but that's not to say like it would be awesome if we could have a conversation.
That's my concern actually, because a lot of these changes that happened within the last 5 years when the Great Recession happened or Great Resignation happened. Mm-hmm. And that's my concern is now I feel like the pendulum is swinging to the other side and a bunch of these companies are going to get rid of these policies. That's my biggest fear. Yeah. A lot of people are backing up from the things that they had pursued in the last few years. Things like work from home. Things like work from home or return to office is obviously really big.
Right.
But yeah, it's been really.
You don't think that there's like I do feel because there's a shift in the generation, which happens naturally every so often. But
every so often, no, it happens every.
Is it? But like as far as like every 15 years, I feel like now we're at that Gen Z is reaching it, and I feel like they
don't give a shit.
Right.
We'll go into that in the next episode.
Oh, you're saying that they don't give a shit about the benefits?
No, I'm saying they will not allow them to take those things away from them.
Exactly. And that's why I'm like, I feel like we are at a crossroads, whereas like the people, whether it's both baby boomers or Gen X that are making the decisions, are met with a very huge, significant backlash as it relates to their employees who are millennials and Gen Zers now.
Yeah.
Where they could potentially keep them.
Yeah. On that point though, on diversity hires, when we were talking about earlier, you're not a diverse organization or a diverse company if the majority of your folks who come from diverse backgrounds are lower level or entry level.
Oh, yes. Yeah.
And it's your responsibility to nurture that talent and grow that talent. And when we talk about this, when I say, having diversity in work, it is not to say that you should hire someone because they're diverse. No,
Right.
what I'm saying is opening our eyes more widely to the workforce that's out there and a
Right.
talented workforce is out there, because I can learn what they learn, but especially because in some of the work that we do, we reflect the diversity hires, if you will,
Right.
like
Yeah.
us,
Yeah.
reflect more of the target audience than, the people that they're normally hiring. So it's
Exactly.
important to hire people from diverse backgrounds so that you have everybody in the room. That's not just about LGBTQ employees. I think that's everything.
That's
It's
across
important.
the
It's
board.
important to hire that.
Yeah. I mean, even like some of our facilities, we had, in 2021 with Afghanistan and, the Taliban and everything that happened, and that we had a lot of refugees, and they were centered around.
So can I preface this a little bit?
Because I don't know.
No, you're fine. You're fine.
Yeah.
I was just going to say that San Antonio was one of the cities that have a massive influx in
Exactly.
refugees from Afghanistan.
Oh, yeah.
Following the American pullout of Afghanistan.
There it is. Yeah. After the pullout, that's what I couldn't remember like what exactly the terminology was. But yeah, no, we had a huge influx of refugees that were Afghan, and one of our clinics was inundated with a lot of these refugees, and we were like, we are happy to help you.
Yeah.
But coming from a Hispanic background, we don't understand the Afghan culture, and then that led to a huge port. Like we had male OBGYNs.
Oh yeah.
And we're like, they've been doing so well.
Yeah.
What's going on? Like, why is there it wasn't backlash, but there was a lot of feedback, which we were like, we need to do something about this.
Right.
And, but yeah, it's important to have the diversity at the table to say, we need to change this, and this is why, and here's how we can do it, because we can change it thinking that we know what we're doing, but at the end of the day, we don't know that difference coming as a refugee here and being from that culture, and what does that mean, and how do they perceive healthcare in general versus who they want to be the healthcare provider and all of that. It's very important, and that's maybe it's a work thing for me also, but of course we can talk about it more in our health episode. But yeah, no, it's really important to have diversity at the table.
Yeah.
Period.
Yeah, not just and I think it's actually, when we're doing this show, it's a big part of what we're talking about, right? Is the diversity stuff.
Yeah.
Well, I'm just having us at the table, having the right people at the table.
Yeah.
Is a lot of what you'll hear as a theme sort of going out. But yeah, do you want to roll into Don't Piss Me Off?
Yeah. I think I'll let you
go first.
Yeah, I'll let you go first.
Ooh, this is gonna be controversial.
We're gonna clock out real quick and to go into the Don't Piss Me Off.
Okay. So when it comes to work, don't piss me off. Your job is not your family. I know that's controversial, but your job is not your family. You have your own family, or you have a chosen family that you choose, but your job's responsibility is to make money for the company. Period. That's gonna piss some people off.
Yeah.
It pissing you off?
Not pissing me off, but I kind of disagree. Oh, I disagree in the sense that I am really close with some of my coworkers.
Okay.
And I call one of them my work wife. And
okay.
And there's that, but I do agree with they'll replace me tomorrow.
They don't give a fuck about you and anything that you do.
No,
you
but
stupid ass bitch.
But I absolutely love my team so much. So I think it's a situational thing.
Yeah.
For me right now, in this moment, because I'm oh, I love that. I mean,
would you, let's say in 10, many years, if you ever went to another job, would you want the exact same thing?
With the people that I work with? Yes.
Oh, okay.
I love that cohesiveness that we have.
Yeah.
I really
But
appreciate
it's not to say that you can't be cohesive is what I'm saying. I think for me, it's a reaction to jobs that I've had that have said that have said
actively saying
we're a family here. We're all really close.
Got it.
I'm y'all don't give a shit about us.
Yeah.
And so I'm lucky.
You wouldn't fire your brother.
Right.
You should. I agree with that.
Business is there, but but I think when you blur those lines, you open the ground to have a lot of bitterness and you. I think because family, you're a little bit more guarded, right? If you need to go ask for a raise, you're gonna go into it and say, I don't want to make my mom upset. I don't want to. You're not looking out for yourself. I think
Agreed.
family is the one space where you're not looking at,
Yep.
where you're looking out for yourself, but then looking out for others as well. I think in those spaces, it's important that you look out for yourself because the company is looking out for themselves.
Oh, yeah.
And so that's the way that I feel about that. Because I think like,
okay. Yeah.
And then I tell people too, if you're working somewhere and the job says, we're like a family here. Nope. I'm not applying. Not applying. I won't apply.
Do you know what one of our values is?
Family.
Treat each other like family.
Ooh. Ooh. Yeah, do y'all do employee surveys?
We do. And they're always like good.
That's good then. So then you're doing the right thing. You're doing the right thing.
I mean, as any organization, everyone has their issues.
There's a better way to say that. What is the goal with that? I'm asking you to speak for the company. But what?
Sorry, no, is it? Oh my gosh, now I'm getting it wrong. No, treat our patients like family. Sorry, that's the value.
Okay, it's a little better.
That's the value. Yeah,
that's a little better. But yeah, having family though.
Yeah,
like if a job say that, if someone says that when I'm even in the interview process, I've stopped interview process specifically because they've said we're like a family here. Nope, I don't want that.
Interesting.
I go to my job. I do my job. I go home. What is on Abbott Elementary, which talks about that? She's like, I go home. I come to work. I do my job. I go home. And that's not to say I don't have fantastic relationships with the people that I work with. And,
I think that's where I'm having a disconnect.
And I do have a fantastic relationship with the people that I work with. But I think when you're treating it as a family, you're being asked to give up something of yourself. And I'm.
Oh yeah. I mean, I do agree.
Mine's a reaction, but mine's a reaction. I'm telling you, mine is a reaction to being in toxic workplaces. Because the places that I've been in that have said that have always been the most toxic workplaces. Where they're like, we're like a family. We all get along. We all no. This is it's a really toxic work environment. Just like families can be toxic, jobs can be toxic.
Oh yeah.
And I'm blessed to be in a place, like I said, that's why I stayed here for so long. Because I don't, as you saw earlier, as you made a face earlier, when I said I've only been, my longest job has been 4 years.
I know. I mean, my current role, this is my 8th year.
Wow.
Yeah. And my husband's like 11, 12.
Wow. No, well, for me, I knew that, I think our generation are in the point where in order to get a significant increase in pay, you have to move like that.
Yeah.
And so once I got to a certain point, then I said, okay, now I'm okay to relax and be, because I think early on I was chasing the job, like chasing the career. Yeah. And I made a conscious decision when I got this job, like my things were going to change and there was going to be a separation between my work and my home. And I've created, I think you know this. I've created amazing boundaries for myself.
Oh yeah,
that doesn't mean I don't work hard.
Mm-hmm.
That doesn't
mean
your ass off. That doesn't mean that I'm not delivering for my job like I was before. But that means I'm able to be a well-rounded person overall for myself rather than for doing it for my job.
Yeah. Actually, now that we had that discussion, I'm like, actually, yeah, I agree with you.
You're gonna
don't piss us off.
Yeah, you're gonna go to work and be like, yo, fuck all y'all. You ain't my family no more.
Y'all my coworkers.
Right.
No, but I love the cohesiveness, but I totally get what you mean.
Yeah, but like I said, mine is a reaction to. I don't think you've been in a toxic workplace like the stories I've told you.
Yeah, no, I've never been in anything like that. Yeah. Like I love my coworkers.
Go get your and take all your PTO. Don't listen to anybody. Take all your PTO. Don't leave your PTO hanging out there.
Oh my gosh.
This job actually taught me because we can't roll any PTO over.
Oh.
So it taught me to,
rest equals resistance.
Right.
Now that we're trying to go like.
But anyway, I feel like there's a lot we could talk about with jobs that we just haven't talked about.
Oh yeah. I know. I actively tell my team members like, you need time off.
Yeah.
Figure it out.
I wish my boss would tell me that.
Oh no. One, because they were like, they were reaching the threshold of like.
No, but I thought you were saying it like they were like crumbling.
Oh no. It's never like that. It's like
they ask us to. They asked us specifically when they get to the threshold. They're like, hey, HR will call me and be like, hey, talk to this.
That is exactly what happens. Mm-hmm. And I'm like, no, you at minimum a week.
Right.
Like I'm like telling them, you need to take a break.
And take your time off.
Because I also don't want them to get burnt out.
It's hard for you to take time off, right?
For me, yes. Even when I take time off, my husband will constantly.
I used to be like that.
I've gotten better.
You have. You've gotten way better.
Yeah. Like I'll turn off my.
I think it depends. If I know I'm taking off when something big is happening where they're going to need me.
Yes.
But I've also, what I love about my job is that no role, if your job relies on you to do those things, then you're not doing your job correctly is the way that I see about things. Not you. I'm not projecting on you.
No.
The way that I feel about it is that if your job has to call you on your day off, then you're not doing your job.
Right,
Why do I say that? Because you're not building the capacity behind you to be able to do the job.
Exactly.
Your job.
I completely agree.
The way
with
that I see things is that I'm not going to be defining my job by the way that the things that I've accomplished while I'm at work. It's what I leave behind. If I leave a system behind that's able, if I get hit by a bus and it's able to keep moving, then I've done my job.
Your job. Yep.
Right.
That is absolutely true.
And I'm not doing that for the company. I'm doing that so that when I do take off, I'm able to relax.
Yes.
I'm able to just kind of hang out and do my thing. But I don't know why I saved it all for the end.
Right. Damn. No, but that was a really good one.
Yeah.
So for me, don't piss me off. Whatever I wear to work, that has no effect on what I do and what I bring to the table.
Oh.
No matter what. If I wanted to wear heels, I'm gonna walk in that meeting room. I'm still gonna be the bad bitch that I am.
Do you feel the same way about shorts and flip flops?
As far as like if someone came in shorts and flip flops,
right?
Well, I just don't like the way that looks. Period.
But do you think someone should be allowed to wear that to work?
There's standards, so no.
Okay.
But what I mean by that is like, if I wanted to, I've never done it, but like if I wore a suit and I wore high heels, people would look at me sideways and be like, why are you wearing that? Don't ask me what I'm wearing. Don't care. Like whatever I wear, if I want to wear something super flamboyant.
Yeah. Yeah, but you can't walk in heels. That's what I would be judging you. I'd be judging the shit out of you, and it wouldn't be because you're wearing heels. Like,
I'm
why is
like
he walking like that?
Like, what do you call it? Like one of those spider things?
You were walking like Caitlyn Jenner?
Like the Puerto Rican governor?
Yeah. Excuse me. But yeah, so, okay, that's interesting. So
yeah.
So,
like, don't judge me based on what I wear at work.
Are you usually the best dressed at work?
Yes.
Me too.
Yep.
Is that a gay thing?
I don't know. And I appreciate being told like, oh my God, you dress so well. Like,
yeah.
And I'm like, I love that.
Not so much right now at this current job because we only see each other, when we're in the office. But usually at my job, I was always the best dressed. Yeah. And for me, it was because it was a reaction to wanting to appear professional, and I don't want anything else to be a distraction. I want them to focus on the work.
Yeah. If I wear something that's super flamboyant or like super glittery, and because I have like these glitter shoes that I'll wear, and sometimes I feel like people are like,
faggot.
Basically.
Oh.
Yeah. And I'm like, if I'm distracted, that's your problem.
Also,
if you're distracted, that's your problem.
Do they bring it up?
One time someone has said something like,
it's sexual harassment.
Don't you think like you should like dress like a little bit more appropriate?
That's sexual harassment. You cannot comment on people's clothes.
Damn, I wish I knew that back then.
It was a woman. I can tell by the way you said that.
No, it was a man. I've had someone also tell me.
Go on.
This is vastly different, but I wanted to bring it up. I've had someone tell me, I was at work and they were going to potentially be a board member, and I was literally meeting them for the first time, and they looked at me and they're like, oh, you have a really pretty face. I'm sure your number is high.
Number as in your body count?
Yes. And I'm like, I have a husband.
Oh my God.
Yeah. Sorry.
Wait. I was gonna take that way left. I'm glad you see me think, saw the way I thought about that?
Yeah.
That's crazy though.
No, yeah. And I was just like, I was so taken aback because I was like, thank you for calling me pretty first, but also like, who
wait, you said that?
You? No, in my head. Because I was, again, when things like that happen,
to associate the two things. No, but to associate the two things, because you are attractive, then that means you have a high body count.
Right. And I didn't know if it was like I took it as a gay thing also.
Yes, and he thought it was a compliment.
Yeah.
He thought it was a compliment.
As a straight man, I'm like,
oh, a straight man told you that.
A straight man.
Oh, no. That's a DL.
A straight man.
That's DL.
Yeah. I told my boss, I was like, my boss was the CEO, if you allow him to be on the board, I'm leaving. Like, don't expect, I left anyways because I moved, but
it is your job's responsibility because you were there in a work capacity to protect you in those moments.
Yeah.
Because that is actual sexual harassment.
He told me this in front of another chief.
And no one said anything?
No one said anything. I think I'm not trying to cover for that person either, but like, I wholeheartedly believe like we were like, so this is way left field. Like, how do we even deal with this situation?
Yes, I've been there.
I was like,
it's not your responsibility though. They have entire teams that are ready to do that.
Yeah. And I was like, literally, it was within the first year of post-graduation, like my first year in my career. And so I was like, I don't know what to say to this. Oh. And I knew he was potentially going to be a board member. So that also threw me off because I was like,
I have a story. I have a similar story. I know we're going way over. You can cut as we go in. But I have a similar story because there was a time when I was on a client call. It was the job previously, the job that I had before my current job. And I was on a client call, and it was a group call. And the client said, we were doing, talking about people having generators in their homes in case the power ever went out during a storm. And we were talking about reaching the Latino community. And this client said, well, I don't think that the numbers aren't as high of people that buy generators, and Latinos aren't. The people who buy generators in the Latino community isn't as high. And it wasn't. It wasn't. But what he was saying was, I don't think it's that high because they don't care if the power goes out or not. They're more used to the power being out, not having power. So I remember I was in Monahans because I was planning my wedding. It was right before my wedding. And no, I was already in Monahans. It was the week of my wedding. And I remember I was just like, oh my God. And I said something immediately to him and said like, this is not, and it's a client. And a lot of times companies feel like they have to protect the client, you know?
Right.
And I was just like, what is going on? Then I had a colleague call me and she said, I'm sorry you had to hear that.
That is not the way.
So the issue was that I was in the room. So he's done some shit like this before and you haven't said anything?
Right. Oh, so that's him on a normal basis.
Oh,
and y'all are okay with that?
I absolutely said something and got an apology from him. I got an apology because I told my boss after that. And she was like, that's not going to happen.
Damn.
Yeah. And they said that. They were like, and that happens along too. I'm sorry you had to hear that. No, that means that you're covering for them. And I get it. In a lot of places we work for clients but that doesn't give them a right to say
whatever the fuck they want.
To say some things
Absolutely
like that.
Absolutely not.
Yeah. People say some crazy shit.
Damn.
But anyway, we'll see you all next week as we continue the show. Well, thanks everybody.
Yeah, have a great week.